Howdy, everyone. Matt here. I got a question for you. What do you say when someone says, the only reason that you tell people to come back for therapy is just to make more money? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic, or something from the physical therapy world. And yes, this is something I have heard over the years through my career. People say it online, but it's that thing they say, when healthcare providers want you to keep coming back, they just want to make money off of you. That's the only thing. And I have heard that, like I said, and you may have heard it, but I recently came across this little clip. Now, this creator, this person, is very outspoken. He kind of runs around in the fringes of things, and I've kind of had an issue. Like, his videos would pop up every once in a while, and he would just have this wild take. And like what he does when, like, I've looked through his stuff, is that he takes somebody's video and he changes the point of it, and he pulls something out. So people put on videos for entertainment, or maybe they talk about one aspect, but then he takes it and he wants to go in his own direction with it and just say, well this, I'm going to point this out. And he often says something that's very hard to argue against. And now, I've seen these from the functional pattern people whenever I've tried to deal with them, that they argue, well, our methodology is the best and it can help with everybody. Well, you start arguing and say, well, no, there's a lot of nuance. And they're like, well, so you can't argue that moving and exercising and eating well and sleep, and having good sleep hygiene is optimal, is suboptimal. You're going to say that, and so they're going to say something that you can't argue against that. You can't say, well, no, that's not true, because the moment that you say, well, yeah, that is true. Oh, you see, you agree that our method is the best. And this is how this guy does. He takes something and he pulls it out that's not even fully a part of what the person says, and he says this comment that may or may not apply, and people agree with it, even though they don't take in the full consideration of everything. And that's kind of what has come from this clip.
I think part of the issue is because the longer things take, the more money that can be made. So the longer you drag things out, whether it be, psychological problems, like I say, if there was someone out there who could fix someone's psychological problems in 5 minutes, okay, would someone who's like had a patient for 10 years refer all their patients to him and say, hey, fuck this guy, go fix it in 5 minutes? I can't, because you've been here with me. Like, no, but now I'm losing money because I can't do with this, but this is what I have again.
So there was the clip. Now, am I going to say, no, he is totally wrong, 100% wrong? No. Statistically, have there probably been providers in some form or fashion who have just tried to get people to keep coming to make money? Yes. I'll admit it. Okay. And if he sees this and takes this out of context, we'll say, if it's one out of the hundreds of thousands, then you can't say it's never happened. So if we look statistically, it has possibly, there's a ton, if we have Dr. Strange and we look through all the outcomes, yes, there's going to be some. But I often see this is said in kind of two groups of people. One, I have heard it from patients, and people have said that. They're like, oh, they just want you to come back just so they keep making money. And I see that very often the reason why a patient says that is that they are frustrated. They don't understand something. They didn't get what they thought out of it. And so this is an excuse or a reason why they don't have to come back. Oh, I'm going to just give this reason and say that this is the reason why I no longer can continue. And granted, I have had people say this, that you just want me to come back to make money, over things that were kind of silly, like a patient saying that when they've had a surgery and they're just like, no, I don't need to come back. However, me as the medical professional, realizing, no, you do need to come back. There are reasons why we need you to come back in. And one example I used to see quite often early in my career were people who had knee scopes. And I used to be next door to a group of orthopedic surgeons. And if anybody came in with knee pain, they wanted to scope you. They wanted to do a meniscectomy or clean it out or just do whatever, just do everybody that came in. And I would tell you that most of the patients, when they came to therapy, only came for 2 weeks. And the reason why it was 2 weeks is that they got their stitches out after 2 weeks. So they'd come in for that 2 weeks. Then as soon as they got their stitches out, poop, they disappear. Now, you may think nothing of a meniscectomy or this scope. You may never think anything about it. But I could tell you, I had so many people that would come back several months down the line, maybe a year down the line, going, I wish I had not stopped. I'm still having pain. I'm still having limited. I can't do things because my knee is still bothering me. I wish I had continued. And we've talked to him to say, like, yes, there are reasons why we want you to keep coming back as a patient. And there are reasons why that you need to come back. We want to make sure that you are progressing properly, that you are getting to doing those last little bit of things that you need to do. I've talked about in that video about the physiology. Yes, we want to ensure that you are continuing to get better. Do we need to add some other things once you've kind of reached this point? Because maybe there's more dynamic things that you can't get into yet, and maybe that you're fearful, or you're just going to start avoiding that we can work on. Now, I would say about with physicians, I would hear this with physicians, like after surgery, well, they just want me to come back, and I ain't got to go back. No, they just want more money. Again, there's a reason why a physician or a surgeon may want you to come back. They, again, want to ensure how you're doing along those paths, because if something has arisen, 6 weeks, 3 months, 6 months down the line, that can change how things go. I've seen people do that with surgeries, that they hit some point down the line with surgery, like, I'm not going back to see the doc. It's like, no, that gives them some pretty valuable information to say, what are the outcomes at 6 months? What am I at 12 months? And sometimes they may just do follow-ups that are just, phone calls or telemedicine. We can do that stuff now. But those can be important to give them information about what is going on. Now, a thing that's the big point that I always share whenever individuals bring this up, is that you've never dealt with insurance companies. I ask them that. Have you ever dealt with an insurance company when somebody throws that out there? Oh, you just want the money. Because most people in healthcare, that's kind of the model. That's where you're getting paid from, is through the insurance companies. The person's coming in is using insurance. The insurance company is paying for the service. Insurance companies don't like providers. I was going to say that we are an expense to them. We are something that they lose money on, because every time that somebody comes to the doctor, or say a PT or some whatever, they have to pay out money, and they don't like doing that. Does any company like spending money? No. Insurance companies, they will gladly raise those rates. If you notice that, they're always raising the rates, but they don't ever want to pay out on them. And if you don't believe me, you can look online and find evidence of this. One, there have been all sorts of physicians, especially, talking about how they have to fight and argue with insurance companies over authorizations for procedures. You can see this when they're doing these peer-to-peer reviews and talking and expressing why they need it. There are other patients out there who will say, I was, sitting in this room ready to have this test, and they are on the phone arguing and fighting with the insurance companies to get them to cover it, because they hit the insurance company at last minute and said, no, it's declined. That is evidence. I'm not saying you can go find it. And that's what I always tell to people. You can go look this up, because I don't want to be accused of saying, no, you're biased by only showing this. No, you can find this information. And I know therapists who put out that as content. They talk about, trying to get authorization for stuff, trying to get people authorized to do therapy. Now, you may be saying, well, you're just trying to get more. I have legitimately had people with major orthopedic surgeries, knee replacements, ACL reconstructions, rotator cuff surgeries. So I'm just going to use those because those are big examples. They get like 15 visits. That's it. No, you don't need any more. You don't need to do anything beyond that. There is a lot that goes into recovering back to your normal function after those type of surgeries. A lot goes into it. Everyone heals different. Everyone progresses different. You also have to consider a lot of stuff, what's going on with the person. Yeah, maybe you could get away with 15 visits with somebody who's maybe young and they have a good support structure at home and they're really understanding and they're working a lot of stuff at home and they're just coming in periodically. But take somebody who maybe lives alone, who's, in their 60s, has a couple comorbidities, who's never really exercised in their life, and they're trying to come back from this surgery, just trying to balance their whole life and add this, and you are the one who is helping them along, and an insurance company's going, yeah, you don't need to come back in and be seen anymore, because patients are just information on a page to them. That's it. In the other ways they do it, again, capping visits. They cap them. They say, oh, I believe Blue Cross Blue Shield's a big one about that, like 30 visits. That's all you get a year. 30 visits. That's it. Nope. Medicare does it. Medicare does it with the cap. Medicare has a dollar cap. They say, nope, if you hit this much money, so I think it's $3,200, and that includes PT, OT, and speech. And if you need all three of those, you're going to go through it. But no. Once you hit that cap, you probably can't go anymore. It's going to be harder for you to go. Again, they put those things in there. What the insurance companies also do, they cut down on what they actually pay. Go look at stuff of what therapists talk about. They talk about insurance companies cutting reimbursement. Now, I know people argue, oh, you just want more money. They aren't paying hundreds of dollars. They're not paying thousands of dollars. They're paying like $20-ish, $30-ish for procedures and stuff that we do. That's what it. So they may pay $33 this year, but they're like, you know what? We want to pay $32.74. They just want to cut and trim and cut and cut and cut and cut and cut. That's what they want to do. They don't want to pay out anything on it because they see us as a problem. Also, insurance companies, especially like Medicare, like to do all sorts of reviews. Come back. Hey, you saw this person 5 years ago. We've done a review. We don't feel like you should have been paid for that. I had this happen with a patient once. Give us all that money back. This patient had a knee replacement, did not do very well, and their knee got very stiff. They had to have a manipulation under anesthesia and then sent back to therapy. You have to get their knee moving. They were denying any of the therapy past that. They said, well, they didn't need it. This person could barely walk. They were high fall risk. They lived on their own. You're trying to just get them functional around their house. And they're saying, no. You don't deserve that. We had all the documentation to show that, yes, this person needed it. So when people bring that up, I let them know, hey, have you ever actually dealt with an insurance company? Oh, you haven't? Then you don't know how it actually is. And to wrap up with the insurance company, here's the thing. If insurance, again, is such this great, wonderful, amazing thing, why are there therapists who open cash pay clinics? Why are there those clinics? Why are those that say, I'm just not going to deal with the headache of insurance companies? Because go talk to them. They will tell you about how hard it is to deal with the insurance companies to get paid for the services that they provide. They say, no, we're not going to deal with that. Whatever that you need is between me and you as the patient. So you're the patient, I'm the provider. Whatever you need, you just pay for that service. You don't have to go through a third person who says yes or no. That's kind of like with buying a car. It's like, hey, you want this car? I want to sell you this car. But no. We need to go call this person that's in the other side of the country to determine on if you can buy the car or not, or what you can do with the car. No, if you want to come in for therapy and I want to work on being able to play golf, because like I'm gonna tell you, like most insurance companies only care about functional things. So stuff like within your home, dressing, bathing, being able to stand and prepare a meal, make it to the bathroom. That's what they care about. If you're somebody who's like, hey, I want to be able to go back and play golf, they can say, well, that's not a required thing. We only, again, really care about what's in their home. So they can limit you on that. But if, hey, I want to pay cash, I want to do this, that's fine. Yeah, cool. We'll go with that. It's not going to cost you anything, hitting that thumbs up button and the subscribe button as well. Back to the video. So I want to talk about this other group, and I want to kind of add it in. And it's this group of that like to say that are people like selling kind of a questionable thing. And I'm going to kind of head on this, but I'm going to kind of interject it on this other thing about with interacting with people. Now, again, those other people that are selling that questionable thing like to say the thing of like, no, those providers, they just want you to keep coming in to make money. Well, here's some truths about dealing with people. people don't like to continue with doing something if they don't believe that they are getting a result. Truly, truly. Like, how often does this happen? Somebody came in day one, and you didn't make all the pain go away day one. Okay, this didn't work. I'm going to go seek something else. How many times has that happened? Okay. Now, you can try to argue, but think back with physiology, with biology, with what goes on with healing and stuff that takes time. Stuff sometimes takes time. Yes, we may be able to get pain better. I've been able to do that with patients. Sometimes they've left out of the clinic feeling 100% better, but I've told them, I need you to come back because I want to ensure that they are doing better, that they are continuing to maintain. I'll tell you a story. Had a guy once, he had an ipsilateral shift, shooting pain down the leg. Corrected the shift, pain was gone. Felt great. Went to the gym that night. It all came back. Nope, it didn't work. No, you weren't healed. You felt better. You weren't healed. Now, those people selling that questionable thing, oh, they're going to tell you, oh, day one, within the first 10 minutes, we can get you feeling all of that. That's what we can get. That's what they can hook you with. Now, being said with those results, it also can be that the person's not getting results in the time that they think they should be. I've had this with patients. I remember one of the first ones was an older gentleman many, many years ago. He had a rotator cuff repair. You know, rotator cuff repairs take time. And he came in after like 3 weeks and he's kind of looking, we've got to get this thing better. It's got to get better. I was like, man, you're 70 something years old. You know, you're not in like the overall best health. You know, he's someone who never really exercised. You know, it's time. You had stuff sewn together. It takes time to heal. Okay. We are doing, if we could snap our fingers and make it feel better, yes, we would do that. Okay. We would. It takes time. But he's making a progress. I see that he's making a progress. I tell him he's making progress, but it's not the progress that he believes. Talk to a trainer about this. Somebody who works with people with losing weight, exercising, that stuff. Hey, we've got a plan here. We can safely have you because again, with losing weight or getting in shape, often you have to change a lot of behaviors and those things. Okay, we're going to have you on a steady path. You're losing half a pound or so a week, and you're going to have this steady weight loss. And you're just going to stay, and you're changing, and you're developing habits, and you're going to be able to keep this off. But the person's like, no, I want to be able to lose 30 pounds in 2 weeks. And that is what is in my mind on what I want. And if they don't, no, I don't like this half a pound a week. I want the big thing. And tell you how often, again, if we get into that, do people actually stick on that? Yeah, they may lose a ton of weight, but they can put it back real easy because you may not you may not gain the habits and things like that. Now, of course, there's probably going to be somebody, I love it when people do this, they pull the one-off. Oh, look at this. There's one-off I found way in the back of a shelf. And look, this is the one-off example. Okay, can you replicate that? Can that be done over and over again? Oh, you found a one-off? Oh, okay. That's like saying like the lotto is a great, retirement vessel. Okay, yes, some people win it, but not everybody, okay? It's that thing. But guess what? Those people selling that questionable thing, oh, we will meet your expectations. We'll do exactly we can do that. That's what we do. We can do that with you. We can help you. So yeah, they're selling on that. And the last kind of group is the people that they see a result. They see some form of a result. Hey, I'm getting better. Gone. Gone. I can find this else. Gone. I tell this to my patients so often because I get a lot of spine pain. I like, don't stop just because you feel better. Okay. Now, those people are going to come after me on this. Oh, shit, you're doing that. Here's the thing. Because we don't know if you fully healed up. You can feel better. But I can tell you, I've seen this once. If I've seen it once, I've seen it 100 times. Sometimes they feel good. Again, like that guy with that ipsilateral shift. I feel great. And they go back to doing everything. Boom, it all came back. We didn't test the integrity of everything and make sure that you are fully healed on it. And I tell them, Now, granted, I'm going to tell you what I do with my patients when they start getting to that point. You're actually seeing me much less. We are talking a whole lot more through text or phone calls or things like that to say, hey, you're going back and you're doing your stuff. I'm kind of coaching you as you are going through this. I'm kind of helping you as you're going, but you're maybe not coming and seeing me as much. Okay. Because I want you to get out and doing those things that you can do on your own. But people will do that. They feel a little bit better. They're gone. They're gone. And just, they're like, and I can't tell you, and you probably had this too. Again, people, they do that and they end up right back in your clinic in a couple of ways going, it didn't work. No, because we didn't complete it. We didn't finish it. Somebody said this in a pharmacology class I took with antibiotics. You know, you're sick, you're taking antibiotics. You know, people will have this thing where it's like, I'm going to just leave a couple in there. I'm not going to finish the whole bottle. And they said, think of that infection or whatever that you have like a campfire. And it's dying down and you got a bucket of water. Well, you pour half of the bucket on there and you're like, that's good enough. Well, what happens when it gets kicked back up? Oh my gosh, well, let me pour the other half on it. Well, that's not enough to put it out. We have to kind of squash it and make sure that you're fully good. But again, I think with those questionable people, they're going to sell in that thing of, oh, you're feeling good. Well, you need to maintain. We're going to help. We're going to get to the phase of maintaining and doing all that. And that's what I see with those people, that they're just really just telling them everything that they want. Now, there's one last little part that he said that, again, I think, I want to break down a little bit. And I think, again, it's very questionable. And here it is.
I get people all the time, therapists. Hey, and this is I did this just to prove my fucking point over and over again, and I'm never going to change. Oh, hey, can you please tell us how you get such remarkable results with your spinal cord patients and your TBIs? Because I've got a patient here like that, and I want to be able to help them, get them more. And I always go, sure, refer them to me and I'll help them. And they all go, oh, no, I'm not going to do that. So you really don't give a fuck about your patients because I can help them, but you don't want to refer. You want their business, so that's what it's about. It's not about helping the patient. It's about, oh, well, I want to know what you, so I can get more business or whatever. And I just say, fuck you. I'm just, your patient's fucked. I'm not going to pass on what I know.
Again, he's trying to say a very, put a defense up where, no, you can't argue with that, because if you really cared about your patients, you would give them to the person who knows everything about it. But I'm going to tell you, this guy, he holds everything that he does so close to his chest. He does not share any of it. And people have tried to talk to him about it. And he's like, it'll just go to the grave with me. It's kind of how he presents it. But that shows, if you don't really care about them, you're just not going to send them over there. That's really something I see that plays on an emotion. So think about those kind of questionable people, again, that are selling stuff. What's a tactic they use? Is an emotion. Think of those alpha bros out there, the alpha guys that are selling those, those alpha courses and all that. They use an emotion. You're not a real man until you've taken my real man course on it. You're just a pansy. You need to learn. I will teach you you're not a real man yet. So you're like, oh my gosh, am I not? Look, well, you're not a real man until you're driving this, $5 million car and you have this and you have that. Well, I don't have that. So it's tugging on your emotions and trying to get, this emotional response. That fear of missing out. Oh, we've got this great product where you can make millions of dollars and have all of this stuff. If you sign up now, you're missing out. That, if you got to buy. So it's playing on an emotion. So it's saying that your emotion that you want to help people and that you really don't care about people unless you're giving them over to me, who have all the information. But I'll say that can get very kind of scary. And I would tell you as a provider, because that patient of yours has a lot of trust in you. When they come to us, patients have so much trust that we are going to do what is right for them. And I do what is right for my patients. And I will tell them, hey, if I am not the one who can help you, I'm going to send you to the one who I know can help you. No, I just said that. Yeah. So you could say, well, you should send to me. But I don't know anything about this person. I don't know anything. And I will say here lately, and we see that this happens online, stuff comes out about people that they were not very good people behind the scenes, that they were not. And like Bernie Madoff, let's just use Bernie Madoff. Look at what Bernie Madoff did. You know, he had all these crazy returns of money. Look at this guy. Look, oh, if you want to be wealthy, you should go to him. People were sending their friends to him. Just, oh, because, and what he was doing behind the scenes. So yeah, he had all the answers. He's playing it close to the chest. He has all these answers, but he was a person behind the scenes that he wrecked so many people. I mean, Bobby Bonilla ended up a good deal out of it with that big, I think his contract. That's a different story. But all sorts of stuff were going on behind the scenes. And you sending a patient over to someone that you're not fully 100% confident in, that you're just, again, going off an emotional thing, and something negative happens to them, you've broken the trust with that patient. So now that patient is like, you put me into this terrible situation. You sent me over to here and put me here where it set me back or it did this. You did that to me. So now I have ruined the trust that this person had in so much because this other person over here was this way. I'm not saying that whomever is, but I'm saying that is an actual thing that could happen. Likewise, this person, you also have to kind of think of personalities. Now, this person is that I was talking about, they're super brash on everything. They're super aggressive. That's their point. And I'm just telling you, just don't engage with them. And I have this stuff. I don't like to engage with these people because you're just going to end up arguing and it's not going to get anywhere. And, people, they try to take these stances and he just comes off. But again, if it's like, oh, I'm going to send you to this person and your personalities don't really match, you could be like, oh yeah, this person's great, but that can again rub people the wrong way. Why did you send me this person? It didn't work with me. Yeah, granted, this guy is always like, this is what you need to have. I don't sugarcoat stuff with patients. I'm straight up with them. I'm not going to be super aggressive with them. You have to understand. You have to talk to people. You have to have a rapport with people. But yeah, it works for some people. I've known people who love that. Cool. Oh, I'm going to send this doc because this doc has that. Oh, I love that doc. Some people are like, I am never going back over there again. It's not what everybody needs. And again, you can probably take that and go with whatever you want on it. But anyway, let me know your opinions about this. What do you say when somebody comes at you and says, oh, you just want people to come back because you just want to make more money off of it. You're just trying to miss, really. Again. And again, do we have all this student loan debt if that was the truth? Because we'd paid off that debt really fast. Wouldn't we have all these like big houses and the nice cars and going on trips? And wait a minute, it's the people that always show that are the ones selling those questionable things. Aren't they the ones always talking about their big mansions and the vacations and flying private and driving some nice car? Anyway, let me know your thoughts, opinions, and beliefs all down in the comments below. If you enjoyed the video, please hit that thumbs button. It helps out so much. Please engage with me. Don't engage with them. Engage with me. And subscribe to the channel. It doesn't cost you a copay. It's free. And until next time, take care of yourself. Take care of your patients. I'll see you then.